Hello, everyone. So my name is Debbie Nixon. I'm Head of Health Policy at Costello Medical, which is a consultancy providing scientific support to the healthcare industry. And I'm delighted to be joined today by Joe, Rick and Katie, who will introduce themselves.
I'm Jo Balfour, the Managing Director of Cambridge Rare Disease Network. I'm delighted to be here today and to share some of your conference with you.
Hi guys, my name is Rick Thompson. I'm CEO of the rare disease organisation Find a Cure. We're based in Cambridge and work a huge amount with lots of different rare disease organisations, particularly patient groups, to help them form, grow and professionalise. So really excited to be here today talking a bit about transition.
Hi, my name is Katie. I work with the Rare Youth Revolution team, who are a platform to provide young people with a rare disease a chance to sort of speak up about topics they're passionate about. So yeah, I'm happy to be here today.
Excellent, good. So I'll just start by providing a bit of background to some of the work that we're going to be talking about today. So back sort of towards the end of 2019, myself and head of our rare diseases division, having sort of worked collaboratively on a couple of projects, started to discuss the possibility of hosting a policy roundtable event with a focus on improving the lives of people living with rare diseases. So we came up with a few potential topics, and one of which focused on transition from paediatric to adult care, which we understood to be particularly challenging for young people with complex health conditions. So we reached out to Joe and Rick, who we had already supported on a few pro bono projects at the time, to see if they might be interested in collaborating on the proposed roundtable, with a focus on the local Cambridgeshire region, and were thrilled when they said yes. So preparations for the roundtable event sort of began, but then they were put on hold due to COVID, so slightly delayed, but we restarted things at the beginning of this year. And preparations included a number of activities to gather insights and to help inform potential topics that we could then discuss in more detail during the roundtable meeting. These included, there was a Find a Cure Rare Chat, which Rick hosted on the topic of transition. We had a focus group with local parents and young people who had recently been through the transition process, which was led by Joe, and a call with a lead nurse from a local hospital who was involved in the care of teenagers and young adults with complex rare conditions. And then on the 15th of October, we welcomed 14 people to our Cambridge offices for an in-person half-day roundtable discussion. The attendees represented different stakeholder groups from the local region, and this included a number of healthcare professionals, patient advocates, patients and caregivers, and a couple of policy experts. And among the attendees included Karen Harrison, who many of you may know through her role as support services manager at Alex, the leukodystrophy charity. And we're now in the process of developing a summary report from the roundtable event, capturing key points of discussion and recommendations from the day. And once finalised, we're going to share the report with local stakeholders and policymakers with an aim to really encourage further dialogue and action to drive change at the local level and to improve the transition process for young people with rare diseases. So I'm now going to hand over to Joe, Katie and Rick, who are going to be discussing some of the challenges and the solutions and the recommendations, many of which were discussed during the roundtable event.
Thank you, Debbie. I'd like to introduce Katie again. So Katie and I are going to have around about a 15-minute chat about the challenges of transition to adult care. So Katie, can you just reintroduce yourself briefly there?
Yeah, of course. So I think, like I said, I work with the Rare Youth Revolution team, who sort of there were a group of young people who with rare diseases that speak about topics we're passionate about. And personally, I'm particularly passionate about transition. So it's good that we're speaking about it.
Thank you. I mean, Katie took part in our roundtable meeting and was incredibly insightful. That's why we've invited her along today. I think we need to start by just outlining what does this term transition actually mean. So it describes the coordinated and planned process by which we move from healthcare that's transferred from paediatric services to adult services. It's often described as the purposeful and planned movement of adolescents and young people with chronic physical and medical conditions from child-centered to adult-orientated healthcare systems. It's complex anyway. Transition is a difficult time. It's a difficult time for many young people, whether they're transitioning in the healthcare sector or to a new school, to a new set of teachers and educators, even to a job. However, with rare conditions, we've noted that there's an additional complexity. Making that transition is really challenging when there are a number of different health conditions wrapped up into the one condition. So going to see a number of different specialists at different clinics, maybe around the country, who are transitioning at different times. So if you're struggling with this idea of transition, or perhaps you've been through it and it was a challenge, I don't think you're alone. I think that's the important thing to hear today. There's a differentiation that I want people to be aware of here. So this process that we're talking about versus the transfer of care. So the transfer of care is a kind of standalone thing. It happens at a set time, and that's set in stone. Full point. What we're going to talk about more today is the process of introducing this idea of transitioning, opening up communication to talk about that over a period of time, and that transition process being a process, a movement through time that we can have influence on either as patients or families. So I'm going to talk to Katie here. Katie's been through this transition process. She's also talked to lots of other young people and young adults who have also been through the process, and she's very familiar with a range of challenges. So Katie, I'm gonna start firing some questions at you here. We've taken these questions from a list of challenges that really emerged from this roundtable meeting that we had. We're not focusing on every single one of those challenges, but some of the real highlights. So I'm going to start, Katie, with asking you a little bit about coordination of care. So in your experience and that of other young people that you speak to, do you find that the transition process is more complex because you see a range of different healthcare professionals, or you maybe attend several different clinics for different aspects of your condition?
I think the simple answer is yes. I think when you're under like a range of healthcare professionals and clinics, it's a lot more difficult because, I mean, personally for me and other young people I spoke to, I think even Karen noticed it with her son and some of the other people at the round table, it's difficult as everyone can sort of transition you at different times. So I was under adult consultants in hospital, but then still under like pediatric physiotherapy and community teams and everything, which just makes the whole process a lot more confusing because you're not really sure where you're at with everyone. And also I think sort of doctors and healthcare professionals and all the different teams don't all necessarily talk to each other. And adult consultants tend to be a much more specialized as well, meaning that you can like end up under a lot more doctors than you were in pediatrics, because rather than having a general pediatrician, you might have to go to someone for cardiology and someone for this and someone for that. And I think just genuinely it can all be more confusing and messy and difficult being at sort of different stages of transition within each aspect of your health, and then also not everyone like communicating when that is happening.
Okay, that's really interesting actually. So it can go from being already quite complicated to even more complex and confusing and messy because of the different timings, and also maybe actually seeing more specialists than you used to.
Yeah.
Okay, thanks for that. Moving on to transparency and communication. I mean, you hinted at the idea that perhaps healthcare professionals don't always communicate well, sometimes between the pediatric teams and the adult teams. Can you tell us how you feel the move from pediatric care into less integrated specialist adult health services could be maybe smoother and less stressful? Could communication help?
Yeah, so definitely. I think miscommunication can be a really huge barrier within someone's transition. And personally for me, mine was sort of mainly failed through miscommunication and no one taking responsibility of my care when I was in that weird in-between bit when you're not in pediatrics but you're not in adults. So I think successful communication between all the teams and all nurses and everything is a really key point, in my opinion, to providing a smooth transition. So I think, like, talking about things that might make it less stressful, I think potentially like MDT meetings with all pediatric doctors and like the referring adult consultant, so everyone's on the same page. And then along with that, sort of things like joint clinics between pediatric and adult doctors, sort of having like, I know personally, I know some people who had like transition handover letters, which are sort of like about the patient and their condition and how it affects them. So even once they're in adults, doctors can go back and refer to that from when they were in pediatrics. So I think making sure there's like solid communication between the pediatric and adult team, as well as the community, is very important. And I think also involving the young person and the caregiver in their transition is really important, and talking to them about that and the fact that all information should be replayed to them. And I think we noticed at the roundtable sort of things like youth workers and transition nurses, or having some type of key person to go to, and that key person to provide you with the information can potentially be something that's also really helpful, I think.
Thanks, Katie. You picked up there on the transition nurses that we had at the meeting. There was also a youth worker, wasn't there? And I found that really interesting, that whole conversation about getting that communication language right. You know, remembering you're not speaking to a child here, you're not speaking to their parents, you're speaking to a young adult, and there's a very sort of special way to communicate with young adults. So I know we'll talk about that later with Rick when we're looking at solutions, but definitely something I think we all need to be very aware of.
Yeah, definitely.
Another huge kind of hurdle that seemed to come up with timing. You mentioned it briefly in the first discussion there about coordination of care, but what age did your transition process start?
For me, it was like very abrupt, like it was just very sudden. My health team personally never actually brought it up with me. I was almost 17, I knew it should happen. So my mom and I mentioned it in a clinic because we were confused as to why no one had. And then sort of all my doctors were like, oh yeah, like we need to do, they just sort of had forgotten about it. And then literally from there was just a series of negative events, and approximately I think like 6 to 8 months after I personally mentioned it, I was transitioned, at least within my main healthcare team. So it was very difficult, as it was like it was so sudden. There was like no consideration of my mental well-being, how I actually felt about this situation, and transitioning over so quickly when I had been under that team for like 9 years. And I think, like we all talked about in the roundtable, it should almost be like a learning process, like it should be drip fed in a way. So even as young as like 12, 13, just having like small conversations about it, or even if the child's able to, like encouraging them to start speaking up a bit more themselves to doctors, because that's something that they're potentially going to have to do in adult services. And then I think another thing we did also all talk about was the importance to consider the mental development of the patient and what's right for them at that time. But I think the basis is and sort of was, and I believe, in my opinion, that sort of the younger, sort of like 12, 13, almost like secondary school age, the younger you start to do it, the more it's gonna, you can do it more slowly and over time.
I mean, it's interesting, isn't it? Because, it's not like young people aren't used to the idea of transition. We all make transitions from primary schools into secondary schools into sixth forms or colleges. And there seems to be quite a well-established process for that now. So I guess it's about establishing a good process, isn't it? It's about establishing when's a good time, when's good to start talking about these kind of things, in what way do people need to talk to you about it, and really, whilst having a process, it having the flexibility to work with individuals for it to be quite a unique process for that individual and their family.
Yeah.
So you mentioned well-being there. You talked about, your experience of of transition being very abrupt, and that itself being quite challenging for your mental health. You know, it is a period of transition anyway, this period of adolescence. It's challenging physically, it's challenging psychologically, socially, you know, everything's changing. Do you think that we're taking this well-being side of things into consideration enough? How was your well-being impacted, if at all?
I think a lot of the times, no. Mine definitely wasn't. And I think then for me, being in adult settings and like then having an experience on an adult ward, it definitely did impact my mental well-being. I mean, obviously like the sort of typical transition age is around like anywhere between sort of 16 and 18. And obviously, as you said, young people can have so many other things going on. So you're like exams and like building independence and possibly like starting work or university, etc., etc. And we seem to not really have any support for anything outside of like our health and medically. And it can be really hard figuring out how to navigate living with a rare disease also around all those other life transitions like university, etc. And we can have enough stressful situations going on without then like throwing a negative transition experience into all of that. And I think also some people, I mean, I think I did, but I think some people can find sort of going into adults and gaining more independence and moving away from the team that they've potentially even been under since birth really scary. But you don't really seem to get that mental health support to help you through that process when it's such a big jump into like a completely different environment.
Yeah. I mean, how did you find those adult settings?
I mean, being blunt, I hated it. My first experience was awful, and even now, like I do not like being admitted to an adult ward. I will try everything in my power not to be, which isn't right.
What's different? What's different about your experience on a pediatric ward to that of being in an adult setting, an adult clinic?
Yeah, I think you go from like a very like lively, colourful experience to a much more sort of dull setting, really. And when you've been used to that setting for, you know, so long, like I said, even since birth, like considerable amount of years, it's a big jump going from having like so much support put in place, like PACE specialists and youth workers, and you can get really close to nurses and stuff, and then you're sort of thrown into another setting where you don't get that support, and it's such a big jump into adult services and such a difference. And you also don't get things like the visiting hours are much more restricted. Your parents can't stay with you anymore, which is quite a sudden jump, especially if you have a patient who really needs their parent to be there to advocate for themselves. A, if they just can't anyway because of some developmental reason, or two, if they're even like just too sick or just not used to that. There's so much to it, really. And I think we all spoke about how we didn't really understand why adult wards in general can't just have like painted walls, murals, and other support in place, but they just don't really. It's not a very age appropriate setting. And you go from as young as 16 on adult ward to like end of life, like 95 years old, which is such a big jump. And you're not really surrounded by anyone who gets you in a way, both in clinics and I think inpatient settings. So yeah, I think it's difficult. It's not very age appropriate, and as you talked about, it's that communication as well.
I really actually love how you've wrapped that all together, because you weren't just talking about the adult setting, the adult clinic being, you know, maybe impersonal or not as nicely decorated. It wasn't about just how it seemed physically. It was very much about the services and the provision and the support that you would receive as part of that setting. So I think you've really captured everything else that we just talked about there, you know, how the setting itself is one thing, but it's also about that wraparound service, isn't it? It's about that setting which supports your well-being through how it is physically, the support that you get there, the services that are delivered there, and it all needs to really kind of wrap together to provide the best experience.
Yeah, definitely.
That leads us really nicely, Katie. Thank you so much for your insight there. To Rick from Find a Cure, who's going to talk a little bit about What should a good transition look like then? We've talked about the challenges, we've talked about the difficult aspects. What does good look like? So I'm going to hand over to Rick. Thanks.
Thanks, Joe, and thanks, Katie. I think it's really interesting to sit and listen to you, Katie, talk about your experience and talk so clearly and articulately about the challenges in it. And that's great to have at this kind of session, so everyone can actually relate to that. And I'm sure there are people in the audience listening now who have similar experiences, and that's part of the reason we're here today. The points Katie has been making are points we heard from other people throughout the work we've done in our focus groups, in our rare chats, and at the round table ourselves. And I think more importantly than that, at this round table, we didn't just have Katie talking about the challenges, didn't just have Karen talking about challenges. We had the nurses, the transition professionals, the doctors themselves also recognising these challenges. And there are genuinely pockets of excellence and work that's really pushing forward in the transition space. But what we're not seeing yet is that rolling out in a unified, uniform way to really affect the majority of patients with rare conditions, which is what we need. So just double down on Joe's message from the start. If you guys right now are having or had a rough transition, a rough move into adult care, you aren't alone. You're not alone within the leukodystrophy community, and you're certainly not alone within the world of rare diseases. And there are people out there who can at very least relate to your experience, and hopefully some professionals out there who can try and help find a way to make it a little bit better and more comfortable for you. So do talk about it. Feel free to do that. So given that, then, what do we think a good transition should look like? I'm going to hit on a few points here that really pull on a lot of the themes that Katie and Joe have already touched on. And the first one really drives into that earlier definition that Joe gave. There's a transfer of care, which is a simple point in time when you move from one to another. And that's all well and good, but then there's a transition. There's an actual coordinated, planned process that starts early and is designed to help the patient, the family, and the clinical team themselves understand what are the requirements of care for these individuals moving forward for their future. And if all you have is a transfer, you don't get any of that packaging. You're almost starting again from scratch in a completely new setting, a completely scary situation that can really set back your care and well-being hugely. Whereas if you have that coordinated process, things can be much more effective and actually improve the way you experience care if done properly. Now, in this coordinated transition process, what you need is a key coordinator, or someone who's a point of contact for you as an individual, as a patient or a family, to tell you what's going on. But what we really recognise is that one person isn't good enough, and too often the system is relying on one person to make this function. But if that person gets ill or moves to a different job or moves to a different region, you lose all of that expertise and knowledge. We need a system which is much stronger than that. We need to tap into the fact that in rare diseases, we are using what are called multidisciplinary teams, ideally to care for the patients, people from very different specialisms in the adult world, including mental health and well-being, including occupational therapy, including every different body system that you need in your given condition. Talking about the transition itself, working collectively to coordinate that with whichever person that patient, that family have the best rapport with, acting as that key contact. And in that setting, you can really have a much more effective, meaningful and beneficial transition for you as individuals, as a family. I think the second point was one that Joe and Katie touched on really nicely as well, is that there's a unique way that you need to think about interacting with young adults. It isn't how you talk to people in a pediatric setting, because what you're looking to do at transition is help these individuals move through what's already a period that's quite hard to manage at the best of times, going from your late teens into your early 20s, and to actually think effectively about how they can manage their own care, how they can influence their own care, and move away from what might have been dependence or a leading role for the parent in many cases. And the healthcare professionals need to have training and support on how to talk about that, on what really are the standards for good transition, and what are the ways it can be impacted and delivered in a really meaningful and effective way. And alongside that, it's not just building the communication to the individual effectively, but building the setting. Can we improve the settings that people are moving into for this transition? Can you stop going from colourful, magical, mystical, wonderful paediatric land with pictures on the walls and fun TV shows, and lots of people like you, and dropping you into a room where you're the youngest person by 20 years with very different issues to the person in the bed next to you. And it's this clinical, scientific, oppressive setting that I don't want to be in, let alone a 20-something-year-old. And that's really something we think isn't that hard to change. And there are lots of examples out there of wards that are for young adults, particularly in rare cancer care, for example, that have made a huge difference to individuals. The third point, which is actually the most crucial point, and I think Katie has just demonstrated the importance of, is that young adults themselves need to be part of that conversation. Transition shouldn't happen to you, you should help it happen. And you should find a way to discuss together and move things forward with people who know how to talk to you, with youth workers, with trained clinicians and healthcare professionals who can help you feel empowered to take control of your care where you're able to, and to understand how you're going to move forward in the future to interact with those clinicians. And that's really important, because it means that you're bringing the well-being of the individual right into the heart of the process of transition and thinking about what's there. And I think the way that Katie has talked about her experience really highlights the importance of that. And actually the work that Katie, you've been doing around some of this with Rare Youth Revolution stresses that it's not just you're not an exception here of people that want to talk about this and have different experiences. So I don't know if you want to share some of your brief thoughts on what you're doing there with the Rare Youth.
Yes, I definitely. So with Rare Youth, I think overall, I think we touched on transition quite a few times. We've done sort of other events with it and have articles in the main magazine with Rare Revolution and stuff. One project another girl and I are doing from the Rare Youth group is we're creating a transition document sort of by young people for young people and like healthcare professionals to be able to get our views and what we want to see happen. So at the moment, we're sort of currently collecting survey forms from either patients or caregivers who've gone through transition, sort of try and collect some views and like statistics about what people have been through. At the moment, it's a bit disheartening how many people have been through a negative experience, but hopefully having that document sort of from a young people's point of view might be quite helpful.
Absolutely, thanks Katie. And it's really crucial to have that. And I think it's important to stress we had a room there full of people who are leading wards, who are moving care, and everyone wanted to listen and listened hugely to the contributions you made. And I think ensuring those young people feel empowered to make their voices heard will make a difference on how these things move forward. So again, if people are out there in the audience now thinking things aren't right, find ways to make your voice heard, find ways to interact with Rare Youth, at least read what they're doing, and feel free to put your voice out there. I think that's really important in this whole process. Another thing I think that came up within the session is essentially that this is a chance to build a number of or entirely new relationships, and it should be an opportunity at the point of transition to start a new relationship with a series of healthcare professionals that you could be working with or getting to know for many more years than you've worked with your paediatric team, and they can influence many also hugely important stages of your life. And finding ways to flip the narrative in a way to help people think about this opportunity to build that new relationship, which can be much more driven by the patient than in many cases, or driven in a different way by the family that's supporting, is crucial. And I think there are adult doctors out there, whether specialists or generalists, that want to have that chance to interact with that way. And I think that was a really nice message that came across through a few of the clinicians there that we should bear in mind. So a good transition should be an opportunity to build that new relationship and have a big impact. And the final thing I want to touch on is, I suppose, the role of charities in supporting all this. It's absolutely clear that in an ideal world, all of this should be managed by the National Health Service, and the healthcare system should work perfectly for rare disease patients as it works for any common patient. Unfortunately, that isn't quite always the case. But what we do have in the rare disease space, thanks to the amazing work and drive of people affected by conditions, are a range of patient groups, of charities who are driving forward the field in the rare community, who are advocating for patients, who are trying to provide different forms of support, care, and guidance to help you with being you, with the conditions and challenges you're dealing with, and to move forward to get better care and better experience. And that applies to transition too. And you guys are all working Alex TLC, a really fantastic charity that have a range of different services available to provide support and guidance to help empower you to understand what's going on in your situation and to give you some hints and tips about what you can do. You know, as I say, ideally that wouldn't be needed, but it's there and it's a support that you should all feel free to tap into in some way, because worst case scenario, you're going to be able to connect with someone else who's having those same challenges, and that can really help you understand how to manage them. Breaking that sense of isolation can make a big difference. So personally, an ideal transition should probably also involve the organizations, the patient support groups that are there to give you that additional sense of guidance, additional confidence in how you move forward to manage the situation, and feel supported in actually advocating for yourselves and what's needed for you as individuals, or you as families managing the conditions that you're managing. And I think that's a really important point for me to sum up on. Before we pass back to our resident expert, Katie, who's going to give us just a few tips on what she'd deal with if she was kind of thinking about transitioning again. So thank you, Katie.
Yes, so definitely, thank you. I think I've come up with sort of a few things, both from me and the roundtable and other young people, which is probably things you said before, but just almost summarising a bit. I think I've heard a lot of people say, and caregivers say, how tiring it is to have to tell your story and go through your medical stuff again and again and again, especially when you go to adults and you're seeing all new consultants. So I think something that can be really helpful is sort of keeping a document that explains your medical condition, like the assistance you need medically, etc. So I think either like patients and caregivers can do that themselves, or with the help of their doctors. Sort of just have that file on them, so instead of having to go through it all, you can sort of hand it over to someone and say, can you give this a read? And along with that, I think not being afraid to ask for help. In the way that I think, well, first of all, transition can be really hard. So not being afraid to ask for some help if you feel as though you need some support, whether that be with like planning or understanding information or mental health or anything else. And I think the last thing is, which Rick touched on a bit, was sort of advocating for yourself or advocating for your child, because I think as you transition, as a young adult, it's so important to be able to advocate for yourself, because our doctors are trying to put the focus more on talking to you, but also just sort of advocating that if you feel as though the transition's not going the way that you feel like it should be, speaking up about that, and getting that point across that you're not happy with how it's going, and just speaking up in general about how it's sort of the whole process making you feel, really. So I think, yeah, those are sort of the main points I had.
Thank you, Katie. I am going to sum up, I think, what's been a really interesting session. And for me, I think the resounding message is empowerment. I think this is very much about working with a system that isn't quite right for rare families yet. But young people themselves, their families, the patient groups and the support networks that are there to bolster and support them. I think we all need to come together to make sure that we understand what the transition process is about, make sure we question when we're not sure, make sure we challenge when things are not in place, and really be the voice of all rare disease young people making this move from pediatric to adult care. I think if we all can feel confident that it's fine to ask, when's my transition going to happen? Is it going to happen at the same time in all of my clinics? If not, is there something we can do about that? You know, when is my pediatric team going to meet with my adult care team? When am I going to meet them for the first time? Just, you know, as things crop up, have a notepad, be writing down your questions, make sure you ask them of the right people, and demand what is yours. I think that's really crucial here, that, you know, Katie and young people like her have really led the way by sharing their experiences and saying, these are the bits that don't work for us. And spending time today sharing that with us. What's not right? Where are the challenges? But where are the opportunities for the future? And what are the solutions? And I feel quite strongly that if we all kind of pull together as a group, we can start to make a difference. So I really hope if there's any young people out there today, any families out there today who are gearing up for their transition, they feel a little bit more confident about what it should look like, what good looks like, and what they can expect and demand. So good luck with that. Good luck with your transition. And thank you to Katie, especially for sharing her insights today, to Debbie for Costello Medical's insight and setting up this opportunity for us all to talk together about transitions, and to Rick for helping us not only run some of the focus groups in advance, but also chair some of the meeting today. So I hope you've got lots of questions for us. You can add them in the chat, and some of us will be around to answer them in person today. Thank you ever so much. Enjoy the rest of your session.